No fisticuffs going on. Not yet, at least. So thank you both for joining us today. We always kind of get a kick out of it when we see the Republicans and Democrats standing next to each other during such a controversial period. So we appreciate you being here.
Thank you.
Earlier today, Nancy Pelosi came out of a closed-door meeting with the president, and she said very assuredly, we will pass health care reform. She is presumably talking about tonight in the House. Do you agree with her, Congressman Weiner?
Yep, we're going to do it. You know, we're going to take a first step towards really improving health care for people who don't have it, holding down costs for people that do, giving all Americans some more choices and some basic standards in the plans that they have, benefits that Mr. Camp and I both have, but we want to extend to all Americans.
Congressman Camp, what do you think?
Well, I think the real problem with this bill is it really just puts government in between people and their doctors. It doesn't lower the cost curve. It actually ramps it up. Massive taxes, massive government intervention, 111 bureaucracies, and a third of the taxes are going to be paid by small businesses. And if we're ever going to get out of this economic recession, and unemployment's at over 10% now, we're going to not be able to tax small business and really kill jobs as this bill will.
Well, the Republicans have made no bones about the fact that they are not happy with this bill, but do you think it will go through tonight?
I think it's going to be close. Look, they have they can give away 40 votes and still pass the bill. But I think it's important that we make the case and people listen to what the American people have said, and the American people have said they don't want this bill. There are things we can do in health care to bring costs out of the system, which our bill does, and we're going to be debating that later tonight. We actually lower premiums. The CBO has verified that. The CBO says nothing about their ability to lower premiums. An average family will pay $5,000 less in premiums under our bill than theirs.
Congressman Weiner, earlier today, Republican Aaron Schock from Illinois came out. I talked to somebody earlier on the program. He said the reason the president is making appearances today and having the Democrats coming in one by one and talking with them is because maybe things aren't so rosy. Have you had a meeting with him? And if so, what did he say?
Well, I was in the meeting that he was at. Look, the bottom line is the reason we have a big majority of Democrats in Congress and he's the president is because the American people said they wanted health care addressed. Republicans are in charge for quite some time. Rates went up, the amount of people that were uninsured went up, and frankly, our deficits went up as well. So we got all three things wrong when they were in charge. Look, there's no doubt about it, this is difficult. We're taking on two big forces here. One is the status quo, and one is the insurance lobby. The insurance lobby wrote the Republican bill. You're going to hear a description of it a little bit later, and those things are tough to shake. It's going to be a close vote, but the American people want us to solve this problem. We can't afford the status quo. You talk about taxes on small business. There's no bigger tax than the fact that next year, each and every one of our policies is going to cost $1,000 more, and every day, 17,000 Americans lose their insurance because they can't afford to buy it. That's a problem we're trying to solve. The Republicans are saying no. That's their prerogative.
Congressman, I know that you both have been able to see what was going on outside with some protesters out there, you know, chanting and saying, kill the bill. Congressman Weiner, what do you want to say to them?
Well, I think they should go to countdowntohealthcare.com if you disagree with them. I've gotten nearly 100,000 people who say we want the public option in the bill. Some of the people out there, I think it may be more than you're saying because each of them seems to have two personalities. On one hand, they don't want government health care, but they love Medicare. I don't know how you do both things at once. 44 years ago when we created Medicare, we heard the same arguments that we're hearing today. Fortunately, we pushed past those arguments and created a quintessential American single-payer plan.
Congressman Camp, you were about to say something? Go ahead.
Well, let me just say, look, in addition to the taxes and government takeover in this bill, they actually put people in jail if they can't afford their health care. They're going to create, and we filed a letter from the Joint Committee on Taxation last night, which is a committee that both Chairman Rangel and I am on. They can have fines up to $250,000, 5 years in jail. I mean, actually, they need to give people a pair of handcuffs as they pass this bill because it is going to send them to jail, and I think that's really an unfortunate statement about America. And let me just say in terms of health care.
Congressman, we'll get to you in a second, Congressman Weiner.
I know.
I
don't think I can
you're
wait.
chomping at the bit. Go ahead and finish, Mr. Camp.
Well, let me just say, look, it was Republicans who brought prescription drugs to seniors, who brought health care to children, and who brought wellness to Medicare, who brought health savings accounts so people can have some control over their health care. We have a good record on health care, and what Americans want is a step-by-step approach, not some gigantic, risky bill that is going to put all of this in play.
Congressman Weiner, we don't want to go to jail. We don't want to go to jail.
No, we don't want to go to jail. But the Republicans created the donut hole in Medicare. We're filling the donut hole and providing coverage. And if there's a concern about going to jail, and I assume Congressman Camp believes that's going to happen, I'll make the deal with him. Anyone who is thrown in jail for not doing this, I'll serve the time for them. That's how sure I am that is just the kind of scare tactics that we frequently hear.
Is that breaking? Have you said this before? Because we might have to hold on a second. Stop the tape. Roll it back. Replay.
Even though I think Camp may want to do the time just to watch me serve it for him, but the fact of the matter is, scare tactics aside, we're going to improve Americans' lives with this bill. We're going to provide coverage and we're going to reduce costs. But if we don't do it, if we do the Republican way and let the insurance companies decide, they themselves say they're going to raise rates 111%.
Congressman Weiner, will you give us the first jailhouse interview if you are thrown in jail?
Yeah, only if Geraldo serves it with me.
Okay.
Look, both bills deal with pre-existing condition. We think that's important to do. We don't let insurance companies throw people off their plans. We don't let them cap their benefits either on an annual or lifetime basis. Our bill has a really solid approach. But look, their bill, it's reality. It raises taxes massively, $730 billion, balloons the deficit. It spends over $1 trillion. And in this economic recession, we do not have the ability to spend the kind of money that this bill does. And this bill, when you add in the doctor part, actually increases the deficit. And frankly, they push spending on this bill outside the budget window so that they raise taxes right away, but people don't get benefits for 3 years under this bill after the congressional election.
And it will continue to rage on tonight. Gentlemen, thanks very much for joining us today. A little bit of levity in the healthcare debate.
Thanks.
Appreciate it. And we're going to be bringing you updates as they happen.